Good evening, ladies and gentlemen. I am Dr. Nishant Sharma. Welcome back to another episode of this virtual series of discussions of arthritis in India, a nationwide dialogue. This series is a joint initiative by Voice of Healthcare and Pfizer, where we talk about the different spaces of arthritis and its care in India. Today, we will be discussing about what is arthritis. We'll try to understand the signs and symptoms, how a diagnosis is made. We'll try to understand the different treatment modalities, the management strategies through none other than my panel experts. Allow me to introduce. We have with us Dr. Saurabh Agarwal, trauma and joint replacement surgeon. Good evening, Dr. Agarwal. Thank you for joining.
Good evening.
Thank you. We have with us Dr. Vineesh Niranjan, orthopedic spine surgeon, Niranjan, Aarogya, Niketan and Research Center, Patna. Good evening, Dr. Niranjan.
Yeah, thank you.
Thank you, sir.
Yes, good evening.
And we have with us Professor Dr. Ananda Kisor Pal, former HOD, Orthopedic and Traumatology, IPGME&R, SSKM Medical College, Kolkata, West Bengal. Good evening, doctor. Thank you for joining.
Good evening. Good evening. Good evening.
And we'll also be having Dr. Gautam Prasad, consultant orthopedic and spine surgeon, Patna, and Dr. Arnab Karmakar, associate professor at Department of Orthopedics, IPGME&R, Kolkata, joining us soon. So while we set the introduction to this particular panel of discussion, my panelists, I'll start with Dr. Ananda. My first question, and obviously setting the tone. What is arthritis and what are some common forms of arthritis that are very prevalent in India? Please.
Okay. Can I share my slides?
Over here, you will not be able to share your screen. You will have to only speak through a verbal route.
Okay. I can only speak. Okay.
Yes, sir.
Okay. So actually, arthritis. Arthritis means arthros means the joint, and the itis means the inflammation. So arthritis is basically it is the inflammation inside the joint. So how to know that? So if arthritis means is equivalent to motion. So if the pain is coming from the joint, that means during the pain, patient is complaining of pain during the motion, that is joint motion. And once that there is no motion, that means the patient is at rest. There is no pain. But once it starts movement, patient is complaining of pain. And in anything which is associated with joint motion, that means painful. And without joint motion is painless. That means it is the pain is coming from the arthritis. So this is basically how to know any lay person can understand that this movement initiates pain, and without movement is rest. There is no pain. That means it may be arthritis unless proved otherwise. This is most important. Okay. Next, what are the types of arthritis? If you want to know the type of arthritis, actually basically it is the inflammation in the joint. So type of the arthritis is a common pathway. So there are several causes of the arthritis, like some mechanical problem, some structural alteration, like suppose there is a malunited fracture around the just vicinity of the joint. The fracture is malunited, so the articular surface is irregular, incongruous. So there is some friction occurring between these irregular surface that leads to inflammation. So this is known as the inflammation leads to arthritis. Or there is an infection. Suppose there is some infection from inside our body or from outside the body. Suppose any intra-articular injection or in any intra-articular some investigative procedure that can initiate some inflammation, inflammation due to some invasion of the pathogens. So there is known as an infective arthritis. Next, so there is if it is an infective arthritis, a high fever. There's a high fever, that is a high intermittent fever, high rise and high fall. That means that the high 130, 103, 104 degrees temperature. Then again it falls again it rises. That means is intermittent fever. There is a high indication of the pyogenic arthritis in adults. In neonates, and that can happen by different routes, by infected umbilical cord like that. Okay, so this is the infective arthritis. Now come to the inflammatory arthritis. So inflammatory arthritis, what do you mean by the inflammatory disease? That means it is basically an autoimmune disorder. That means some cells in our body that is considered as a foreign cells, and the body starts to produce some antibodies against this foreign cell. There's antigen antibody reaction occurs, and these antigen antibody complexes, they deposit in different parts of our body where the vascularity is more. In our musculoskeletal system, the synovium is the maximum vascular area. So this antigen antibody complex deposits in the synovium and leads to arthritis. That means that is synovitis followed by the arthritis. So initially inflammation in the synovitis in synovium, ultimately the whole component of the joint is involved. So that is arthritis. Inflammatory arthritis sets in. Typically, it occurs in multiple joints. Multiple joint means there is at least 4 or more joints may be affected simultaneously, and that is most
Okay.
important. And there is some waxing and waning of symptoms. That is symptoms. Suppose in January, February, March, it is severely symptoms. But again, after April, May, June, July, maybe symptomless. Again, it comes again. So it is a chronic course, and there is an increase and decrease of the symptoms, waxing and waning of the symptoms. Another important characteristics of this inflammatory arthritis is there is a pain is basically comes out during its rest. All the diseases remain at the other side, and inflammatory diseases remain the other side. In all the diseases, pain increases with activity, and it relieves once the patient takes rest. Whereas in the inflammatory arthropathy is the exception, where there is a pain occurs during the rest. That means at the later part of the night, when the
Right.
patient is asleep, the patient becomes severely becomes awakened because of the severe pain, even during the change of the posture. So that there is a little amount of movement occurring in the joint that leads to severe pain. And the early in the initial part of the day, that is the morning, in the early morning when the patient awakens up, patient severe complaint of severe pain, and usually it will be relieved when the goes into activity, because in the rest these antigen and antibody complexes deposits over the joint area. When it starts mobility, because of the circulation get washed away. So that is the basis of rest pain relieved by the activity. So polyarthritis, waxing and waning of symptoms, morning stiffness, or the rest pain relieved by the activity. So these are the feature of the inflammatory arthropathy. Another
Right.
important in arthritis is the osteoarthritis. Basically, it is a
Mhm.
degenerative disorders. What do you mean by the degenerative disorders? Because the degeneration means there is a gradual reduction of the structural integrity and also the function of a particular part of the body. In our musculoskeletal system, most important part which gets degenerated initially, that is the articular cartilage. Why it has happened? Because articular cartilage doesn't have the lymphatics, doesn't have the blood supply, doesn't have the nerve supply. It is entirely dependent on the synovial fluid. So, as aging during the aging process, once the flow synovial supply is reduced, that leads to severe. There's a devoid of the nutrition, and with some other external factors like obesity, some lack of the sex hormones. I will come in the risk factors. So these risk factors, when they're present, that the articular cartilage is damaged, and that leads
Mhm.
to osteoarthrosis. And basically, it represents in the patient will complain of pain following inactivity. I can tell it is a cinema hall sign. That means after sitting for a prolonged period, once they start movement, patient will complain of pain in the weight bearing joints,
Mhm.
especially the knee joint, ankle or the hip joint. And once it continues the movement, the pain is little bit relieved, and again it comes if the patient continues the movement. So pain following
Right.
inactivity is the feature of the osteoarthrosis. And once there's inflammation, full blown inflammation sets in, that leads to pain all over the time. So it's
Right.
osteoarthritis. So these are the common types of arthritis.
Thank you. Thank you, Dr. Ananda, for setting the introduction and a good start to this discussion. Dr. Saurabh, my next question will be for you.
Yeah.
Like Dr. Ananda just mentioned, key risk factors that are associated with the condition. I'd like you to put your light on that, please.
Risk factors for arthritis generally for today it is the lifestyle. Actually, the people have getting the sedentary lifestyle, so there is very lot of inactivity. The most common arthritis we are dealing is osteoarthritis nowadays. Apart from second most common, probably the rheumatoid arthritis, which is an autoimmune disease. We don't have control over that. But the most avoidable arthritis, I can say, the osteoarthritis can be avoided if we modify our lifestyle. Uh, as sir said, increasing weight. Obesity is a big factor that is contributing to the osteoarthritis these days. And sedentary lifestyle, the lack of exercise, the poor nutrition, the dietary quality has been decreased, and use of this different chemicals, fertilizers these days, the quality of food has also very much decreased. All these factors are contributing to rise of arthritis patients these days.
Right. Thank you, Dr. Saurabh, for setting your views on that. Dr. Vineesh, my next question will be for you. Let's talk about diagnosis, how a diagnosis is made for a patient with arthritis, and I want you to emphasize on the importance of early diagnosis and the role that it has in the overall treatment outcome as we see. You're on mute, Dr. Vineesh. You'll have to.
Okay,
Right,
right. I am audible.
right, sir.
Right. So you have to understand that today we are meeting here as a part of technological solution, leveraging technology in the knowledge, increasing the knowledge of the society. Hopefully, this message will be going passing to the normal public and not to the doctors. And so we have to talk in relation so that they are benefited from the talk of today, which can be presented in the technological form in today's world, like the webinar and other social media. So the what we have to understand that diagnosis is basically clinical. The first thing, the patient, what the patient's complaint is, uh, that complaint in itself is most of the time sufficient to let the doctor understand that what type of disease it is. In arthritis, depending on the type of arthritis, osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, they all have different clinical setups. They present differently, and with the format of the clinical presentation, which the patient complains, they are in itself initially sufficient, which are then reinforced with the radiological investigations and blood investigations. The clinical features will differ on with all types of arthritis. In osteoarthritis, it will be basically pain and stiffness, reduced mobility. In rheumatoid, it may present as multiple polyarthralgia with morning stiffness. In ankylosing spondylitis, they normally start presenting with back stiffness, and they can all increase. They can converge in all between. I'm talking only to let the layman understand what they should they need to understand. Let the doctors do the rest. To supplement with the clinical presentations, we have radiological X-rays, which can let you know what grade of osteoarthritis you are dealing with. If it is osteoarthritis, it is grade 1, 2, 3, 4, and depending on the type of grade which the patient presents with, the treatment will differ. Normally in grade 1 and grade 2 osteoarthritis, it is more of a management strategies which will help, like the lifestyle modification, physical therapy, joint protection mechanisms, medications. Um, in case of rheumatoid arthritis, the presentation is to find the cause diagnosis early and to start helping the patient understand that it is a problem which is going to stay with him. The waxing and waning will go on, and you have to stop damage of the joints early as possible. With the recent modern medications we have, we can stop them going to a stage which is irreversible, and let them enjoy the life. In ankylosing spondylitis, basically, it's a low back pain starts with, and these patients are these diseases are something which are not going to resolve. The patient has to live with the disease, and that has to be, and patient had to understand that I have this disease. Now this is confirmed with the radiological investigations, X-rays, MRIs, blood investigations, which will conclude that what type of arthritis the patient is having, and they have to understand how they have to cope up with the life. In ankylosing spondylitis, it is important that they have a good lifestyle, active lifestyle, regular exercise, because the more they rest, the more their stiffness will increase. So they have to be prepared that they don't have to make their joints stiff. So the thing is that let the patient doctor do the treatment. The doctor's responsibility is that they should let the patient know that you have this disease and what is the mode of presentation and the lifestyle changes is going to happen. If they understand their disease properly, they will help the doctor in the treatment and helping them, that will help him live the life as less pain-free as it is possible.
Right. Thank you, Dr. Vineesh, for that wonderful answer. Welcome, Dr. Arnab. I wasn't able to get a chance to give you an introduction in the starting. You will hear us. Okay, appears that Dr. Arnab is not here right now, so no problem. We'll circle back to Dr. Ananda. Dr. Ananda, my next question for you will be, we know arthritis affects a wide range of age groups. So what lifestyle modifications, in continuation to Dr. Niranjan's answer, what modifications or preventive measures do you recommend for individuals who can reduce the risk of developing arthritis, especially in the younger population? Yeah, please. Sir, you will have to unmute yourself. Yes, please.
Okay. So it's a very, very important questions. Just before starting my actual answer, just I want to add something, that is the early diagnosis. See, some arthritis, some they are very slowly progress. Some arthritis very rapidly progress. And that also, that basically dependent on some lifestyle, some external factors, and some internal factors. The internal factors, we cannot change at all. Internal factors like some diseases like inflammatory arthropathy, those who are suffering from, I'm very unfortunate there, because if these diseases are not controlled, then it is very difficult to prevent these end stage arthritis, and ultimately that will require joint replacement. But in other parts, if there is no significant internal disease, still in our next generation, like the younger, as you were telling, they are suffering from arthritis, and basically these arthritis it's a degenerative arthritis. That is why previously we are talking that this degenerative arthritis is a disease of the older age. Now it unfortunately the younger age group, they are also being suffering for this. So let us discuss about some lifestyle modification or some environmental problem. So see, there in our what is the important for the arthritis? Arthritis usually what is the common joint involved in our arthritis? Basically, are the weight bearing joints. So in our weight bearing joints are the lower limb joints, basically they are knee joints. This is most common joints involved in our body, in our developing countries, as we are having the squatting habit or the sitting cross-legged habit, whereas in the Western countries, that the hip joint is the most common joint involved. In the upper limb, basically this the base of the thumb, that is the first carpometacarpal joint, is most involved, because this is the most active joint. So that is, as I've already told, the arthritis is related with the activity. So it is a joint is like a machine. So if suppose in a car, so if it is a diesel car, the engine should be removed once there is 1.5 lakhs kilometer run. So if we run, it's much more. So that will easily that becomes damaged, and we have to use in a wise manner. So how it can be done? So we have to concentrate our strength of our muscles, because muscles that protect the joint, the muscles are significantly stronger. They causes the unloading of the bones, which are responsible for the weight transmission. And in between these bones, there are one important structure I've already highlighted, that is the articular cartilage. So basically this arthritis damages the articular cartilage very soon. If it is completely damaged, there is no point of no return, and that is the only arthritis, and the management of only in that stage is the joint replacement. So we have to understand our diseases, our society, the persons of the society, our patients, our relatives. We have to understand. We have to diagnose it properly in early manner. So what is the lifestyle? So if in our younger age group, we are indulged in different physical activities like football, cricket, like this. But our next generation, they are not very much indulged in the physical activity. They are very much concentrated on the indoor games. This is the most important. So that is how they are losing both wise. One is the lack of physical activity, which is required to develop our muscles. They are not doing that. There's a Jones that is the one's Wolf law. This is a form follows function. That means, well, if you are using your bodies, you are developing your muscles, then your structure will become developed. So that is the most important. But our next generation not doing that. So we have to encourage our next generation to have the outdoor games. They have to encourage our outdoor games. This is one. And to avoid the outdoor games, once they are concentrated, they are confined in the home. So even in the e-class, they are very much used for the e-class. Not only they are completely their fault because of the COVID situation. Most of they are confined inside the home. So they are actually lacking to expose their skin to the sunlight. So this is extremely important for development of the vitamin D. So basically, actually, I advise our patients or all the patients to expose their 1/5 of our body surface in between the 10 a.m. to 3 p.m. in the sun, at least for 30 minutes. This is most important. Why in the middle of the day? Because in the middle of the day, sun is going directly towards the earth, and their ultraviolet B rays remains for longer time. So that which is helpful for production of the vitamin D in our skin. That is not happening in the early part of the day or the later part of the day, but the zenith angle is much more obtuse. They are coming and and reflects much quickly. So the ultraviolet rays they remain very short time in our earth. So its ideal time is 10 a.m. to 3 p.m. So we have to expose our 1/5 of body surface, not the face. We can cover the face. We can use our sunscreen also, but in only in the face, not on the other side. This is also sunscreen disease. Sunscreen disease also, that means if you are using excessive sunscreen, they can completely, usually sunscreen sun protection factor more than 30, they can completely block the ultraviolet B rays. So that in this way we are losing to develop vitamin D. So the vitamin D is required for the muscle as also the bone strength. This is most important. So we can use the sunscreen in the face, but not in the other parts, and that is how we can increase our bones. So this is second. Third, the style we are sitting in our desk. This is most important. Most of most of the clerical those who are using the clerical job, they are keeping their chair far away from the table, so that they have to lean forward like this. So in that way they are straining their back muscles much more, and they are become easily fatigued, and that can cause pain. So we have to use their negative desk. That means we have to keep our chair a little bit deeper under the table, so that the table will come towards our chest like that. So that we don't require to lean forward, and there must be some rest there. So where we can keep our upper limbs to the rest. Okay. So that will reduce, that will unload the undue weight on our surface. That is most important.
Right.
Not only that, we have to increase our core strengthening exercise. Core strengthening. Core strength means what? That is your strength of our back muscles, waist muscles, thigh muscles. So if it is there, so provision, we have to use the staircase, not the elevator. This is most important. We have to use the staircase. If there's a scope, we have to walk for a little bit more, to catch the train or the bus, or to a car. So that we have to walk. Walking is extremely important. Why? Because as I've already highlighted, the articular cartilage doesn't have the blood supply, articular not supply, and lymphatic supply. They only understand the language of weight. That is the proprioception. So if we allow walking that leads to load bearing, there's load that is in between the articular surface, they can get the nutrition. So this is proved. If we encourage walking, even in all age group, even in a cardiac patient also, we have to encourage the walking. So this is the basic lifestyle. And another is the food habit that will come. It's a very, very good, that is a very big way. In our favorite cinema hall, we are taking the cheese popcorns, as cheese is containing of rich in calcium. But at the same time, we are taking also the cold drinks, and the cheese and the cold drinks is a very, very bad combination. Because as we are, if we keep our any butter or the any fat products inside the fridge, what happens? It becomes solidified, and it cannot be used. It is uneven. It cannot be used like that. So we have to make it give some heat to make it liquefaction. So if you use the popcorn along with the coffee, that means if you either use the popcorn only, or you have to use the coffee, so that that cheese becomes solid, it becomes liquefied, that can be easily absorbed in our gastrointestinal system. But if we make it solidified with the help of application of the cold that means it becomes solidified, and that becomes discarded through our feces, that cannot be taken in our system. That is a very dangerous truth. So that is, these are the lifestyle modification you can use that. And you have to, that is another important, we have to increase our core strength as also the stretchability and flexibility. The bodies which are maximally flexible, they are less developed, less they becomes injured in a very in the long run.
Right, right. Thank you, Dr. Ananda, for that nicely elaborated answer. Dr. Saurabh, my next question will be for you. Any common myths or
Yeah.
misconceptions about arthritis that you have seen in your day-to-day clinical practice that
The
you like
most
to
common myth I
discuss?
will, yeah, the most common myth nowadays I see is that I can't get arthritis. It's so early age. Actually, people are avoiding to visit the doctor until unless they are a limitation of their day-to-day activities. Then they develop pain. They just take over the counter medicines, and we are just keep trying to avoid that. No, I am not having any problem. No, I am not having any problem. It's just people just go, and they sometimes try to relate it with some trivial trauma. That something is that it is because of trauma and it will go with some time. So early diagnosis and early treatment is key for the success of the treatment of arthritis. I think so. So they should visit the doctors once they start having pain regularly, and they should not avoid till that they are incapable of doing their daily activities. Delayed treatment, uh, delayed presentation leads that we are not able to cure them. Then we just treat them. They just came us to when it is at an irreversible stage. So they should visit doctor early.
Right. Thank you, Dr. Saurabh. Dr. Vineesh, my next question will be for you. As we have understood a lot of management strategies and lifestyle modifications that Dr. Ananda, Dr. Saurabh, and you yourself were telling, could you elaborate on the importance of the multidisciplinary approach that is there required in managing arthritis, including the collaborative efforts of rheumatologists, physiotherapists, and other orthopedicians, spine surgeons in your approach, and how does this actually benefit the patient? Please, Dr. Vineesh. Sir, you will have to unmute yourself.
Okay, so we have to understand that it is not a disease which has a solution on the doctor's prescription pack. It is a collaborated effort of the patient first, in association with the treating doctor who understands what the disease exactly is, depending on the type of arthritis, what type of arthritis it is. I missed the point of the gouty arthritis, which is normally due to high protein intake, that also is diagnosed by investigations and other things. So other than the doctor diagnosing the arthritis and asking the patient to have their lifestyle and changes, medications, other in support of that, the role of exercise, which can be supported by the physiotherapist by asking and making the patient understand that what type of exercises are good for them and what type of exercises are not good for them. At the end of the day, we have to preserve the joint and not damage the joint. To the extent of the exercises are well and should be initially for the they should be the patients, they have never studied the medicine, so they need a plain simple answers and understanding on how they should take their body forward. For in that role, the role of physiotherapist, the dietitian who can help them understand what exact medicine food habit is good for them, because in a normal culture we think that is good food is a good rich food rich in ghee, dalda, and things. So you have to understand that they have to be taught from the basic, from A, B, C, D scratch, that what good foods are good for them. The role of the fruits, milk, vegetables. They are more important because they are they are biologically rich in calcium. Their role should be imbibed in them, that they're eating things which are rich in good foods, good nutrients are important. Uh, Other than that, they can help them understand what their limits of food should be, so that they don't become obese. And if those, some those people who are obese, and that is the cause of arthritis. How to help them in reducing the weight. They all play a vital role in treating the patient. Treating the patient is not medication. Treating the patient is to let the patient understand what the disease is and what they were doing wrong, that they have landed in this situation. Somehow their bones have gone weak, and that has landed them in this situation. So if once they understand their body, once they understand the type of disease they are having and why they were having it, they will surely try to change their habit, and everyone wants to be healthy. So the role of each and every participant it is a collaborative effort of all the departments, which needs to be emphasized. It is not a thing between a doctor and the patient straightforward.
Thank you, Dr. Vineesh, for that wonderful answer. Dr. Arnab, I hope you are able to hear us. You're on mute. If you can maybe unmute yourself. Okay, no problem. So, moving the conversation towards another part of it, Dr. Ananda, my next question will be for you. As we know that there are regional insights to the prevalence, some variations in prevalence according to socio-economic parts, some prevalent changes according to let's say urban-rural difference of where the people are staying. How do you feel all of this prevalence affects the overall healthcare delivery that India is providing for arthritis care right now? Please. You'll have to unmute yourself, sir.
Just before going to that, just I'm adding some points from the previous discussion. So that is there are some self-screening test. Self-screening test is very easy for our audiences. So to take, so whether they are suffering from arthritis or not, I shall give a very simple test. That is one is a simple get up test. So if any person sit in a chair or tool for at least for 10 minutes, after 10 minutes they asked to stand up. If they use their hands, and they say hand is required to have some support during getting up, that means their muscles in the back and the thigh muscles are relatively weaker, and they are going to develop their osteoarthritis or fall, or arthritis in the lower limb joints. So they have to take action. This is one. Or during them getting up, they are feeling pain in the lower limb joints. That means that's I already told you, it is maybe a cinema hall sign, or just during pain during activity, during initiation of the activity. These are the just get up test. It can anybody test by after sitting in a single area, single sitting for 10 minutes, they start to stand up, and whether they are using their hands during stand-up. So this is a simple get-up test. This is easily to rule out whether the patient is having any problem in the joints or the muscles, the large muscles. This is one. Okay, and the exercise, and okay, we can come what are the which exercise will be beneficial. Now the region-wise. Now region-wise affection of the arthritis. Now yes. Basically, this arthritis unfortunately is seen commonly in the urban populations much more than the rural population. This is most important, because the rural population, they are using their physical activities much more than the urban. There maybe there is a main reason, or they are exposing themselves in the sunlight. So that is why they are not very much significantly affected by this arthritis. I'm talking about the mechanical arthritis, osteoarthritis, not the inflammatory arthritis. Inflammatory arthritis may happen in any rural or urban areas. That depends on that. That is actually some chromosomal genetic problem. So I'm not talking about that. But the arthritis which is actually related with some lifestyle problem, or the osteoarthritis, that can affect much more in the urban population, because they are avoiding their physical activity. This is most important. That is coming in a big way. And other persons is a female person. They are losing their female hormones during their menopause. This is the most important. So that is why it is directly related. That is small joints problem. Small joints in the hands, in the feet, in other parts, they are much more affected much earlier among the female persons than the male persons. Okay, So this is the most important. And another is that there are some diseases like hypothyroidism that which leads to some weakness of the muscles, which are another risk factors for acquiring arthritis much more. So that is also very much common in young and also middle-aged female also. So these are the usual gender discrepancies you can see in our country. And again, the ankylosing spondylitis is basically, it is a spondyloarthritis which is much more common in young adult male. So suppose it is a 25 to 35 years male, it's a complaining of pain in the back for at least persisting for 3 to 6 months, coming off and on, and then especially in the rest, pain is coming in the rest relieved by the activity. So this first it is persistent for more than 6 months. First diagnosis should be considered, it is the spondyloarthropathy, and that should be ruled out by some clinical examination, also the to rub the sacroiliitis, and also the MRI. MRI is the most sensitive investigation which can pick up this sacroiliitis. So it is a gender wise. So this is the affected portion of the arthritis. Now the urban rural population, I've already told, the lifestyle related disease may be considered as a lifestyle disease, and that is much more common in the affluent society. So that is why the incidence of joint replacement is now coming in a big way among the affluent societies in the urban population. So not unfortunately, those who are very lower population, lower economical status, they are not requiring this sorts of end stage arthritis requiring joint replacements. This is this is a fortunate. This may be a natural. That is nature is doing this balance between this.
Right. Thank you, Dr. Ananda, for very, very rightly describing about the notable differences and variations that we see. Moving over, let's move this conversation towards patient education and awareness. My next question will be for Dr. Vineesh. How do you feel can healthcare providers and communities work together to improve arthritis care at the ground root level, at the grassroots level? How do you feel, please? Sir, you're on mute.
Yeah. So we have to understand that a great amount of work has to be done on all the platforms, because it is we don't want this to be treated as a disease. We have to understand that it is happening because there are some lack of awareness, lack of education, lack of healthcare, uh, lack of socioeconomic status. Uh, there are some cultural beliefs which are helping the disease to grow. So there we have to strike on each and every point individually. So depending on the first thing, what we are doing right now is a type of educative webinar using the technology. So if this video is seen by someone who is interested, he is facing a problem of arthritis of any sort, they can at least learn something back, and then they can understand the. So this is one of the ways which that is the only reason we have come here, so that the people can benefit from our talk, because everyone does not reach us in daily lives. For the assets of the healthcare, it has to be provided on the government level, on the NGO level. That infrastructure development of the hospitals in the rural areas need to improve, because once the diagnosis is, the treatment becomes easy, and the disease is delayed. You don't have severe disease in early stage. Normally, what is happening that in rural areas, the patient come to urban areas for treatment only if when they are they have already damaged joints. So that has to be taken care of. That the diagnosis, the arthritis clinics can be set up in the smaller places, rural areas where their people are deprived, so that they can be treated early, so that their disease does not progress. Socio-economic factors, the society is improving, they are having their better livelihoods, they are having better resources for food. Gradually, I hope India is progressing towards a better society in terms of socio-economic status, and this will help in improving the decreasing the disease load. Yeah. So uh, we have to understand that we also have to do some. That is resonating, I think. Yeah. So
Yes.
now we have to.
Maybe
In
I'll have the rest of the people muted, apart from you, sir.
hello, right? So we have to also understand that in post-COVID era, we are already we have the role of technology, which has become suddenly everyone has understood the technology use of technology, and this technology can be used in many ways to let the person who are in need understand the disease, their problems early, whether it is their lifestyle problem, whether it is their social problem, whether it is their medical problem. If so, we have to you do collaborated analysis, and on each and every platform we should keep on improving. We have to improve on our medications, our treatment modalities, that is being done by the research and more development of new modalities. There should be some ways in which the society can be benefited with the use of if someone needs orthosis techs supports, that can be provided by the government, by the NGOs who can help them decrease their economic load. So it goes all parallel to develop a arthritis-free society. The role of many individual group of people has to come up, who can play their own role, and at the end of the day help decreasing the load of arthritis.
Thank you, Dr. Vineesh, for that wonderful answer. Good evening, Dr. Arnab. Finally, we are able to see you. Welcome. Thank you for
Yeah, good
joining us.
evening. Actually, because of hello, sir. Hello, good evening. Because of signal problem, I was trying to, keep in contact. I was hearing the beautiful discussion going on arthritis of Professor Pal, and so it's very nice to be here today on the eve of World Arthritis.
Thank you, Dr. Arnab. So, to start my conversation with you, I'd like to understand your opinion on any recent advancements or innovative treatments in the arthritic management space, as we know that you'd like to educate our audience about. Please.
Yes, yes. So, as I think it's already been discussed, that arthritis has got various stages. So, as Professor Palsar has already described, that it initial to start with, we have a huge impact to in the scope of prevention of arthritis. So, the modern technologies which are there to help you to diagnose things at the earliest. So, we have nowadays very much nice MRI scans, MRI cardiogram scans who can describe or detect the arthritis at an earliest stages of some cartilage defect or cartilage destruction. Like a joint which is very essential for our lifestyle is a knee joint. So any arthritis which affects the knee and degrades the cartilage, and if there has been a focal degradation of cartilage which can affect the functionality of the knee, the stability of the person will get hampered. So in that case, the early detection is possible nowadays, and if we can detect things early, the intervention has changed radically, drastically in last couple of years. The things has become changed drastically. We have now a plethora of newer pharmacological agents which can control one of the worst scenarios of arthritis in day-to-day life. And being an orthopedic surgeon, I would like to emphasize on the surgical part, surgical treatment of arthritis. Now, the modern arthritis treatments that we previously we could not thought of think of. Nowadays, we can do some regenerative procedures of cartilage, like so that we can regenerate cartilage. We can do some cartilage grafting. That means we can transport cartilage from a healthy part of the joint to a damaged part of the joint, which is necessary for regular weight bearing, regular exercises. And finally, at the end, there are multiple options of doing some joint replacements so that the functionality, the mobility, and ability of doing or having an almost normal day-to-day life can be given to our patients.
Right. Thank you, Dr. Arnab, for sharing your views. Moving on, Dr. Ananda, my next question will be for you. In talking about addressing arthritis in the vulnerable population, how do you feel arthritis affects the this population, be it elderly, be it people less available with healthcare resources, and are any specialized programs or initiatives that you are a part of or you are aware of which can help this unique needs of such populations? Please. Sir, you'll have to unmute yourself.
Yes. There is extremely important and practical questions we have to look forward for our next generation and also our arthritis patients. Basically, once the patients has arthritis, their mobility becomes restricted. They don't. Their capability to go in the healthcare is becomes limited. So that is why they becomes neglected a little bit. Once they come in a healthcare system, they are become very much advanced. So in that case, very few options are left apart from the joint replacement. So in the initial, at the outset, at the first, we have to make a awareness program as you are doing that. So this is I think I am requesting you to make it. This is arthritis day. So we are commemorating the arthritis day, but that this type of awareness program should be continued throughout the year in different parts of our country. Those who are not very much aware of that, like our in the remote corners, so in those areas, if it is not possible to do this image guided, we can do the physical program also by the camp. There's already some program is going on by the initiative of some government. Basic aim of this government, like the Duare Shortcut, is already it is going on. But basic aim is to identify those patients, those who are having some arthritis, early arthritis, so that we can identify it, we can treat it properly, so that we can prevent its in such arthritis. So this is most important. First is the awareness. Next one is once it is identified, then we can make a group, like a WhatsApp group, or make a we have to make a group like that. So in a region wise, suppose in the North Calcutta, there is a group. So there may be some physicians or some orthopedicians, maybe physical medicine specialist or general physician. So in all these doctors or this related community, we can make a leading role to make this sort of committee, so that any persons who have arthritis, they can report to them. So these persons, they have some support system. They require some support system from different parts. So what they have to do, which exercise to be done. So what are the food specially which will prevent their arthritis. Well, during their severe painful episode, what will you do, what to be done. So everything to be answered. So region wise, we have to make a committee which consists of an orthopedic surgeon, maybe a physical medicine specialist, some general physicians, because patients are very much caught by the general physicians much more than the orthopedic surgeons. So this
Right.
make a community, and they will make awareness program regularly, and the arthritis patient, they will report to that community. So and even if those who are suspecting arthritis, they can be included, and they can be addressed in a timely fashion, so that the arthritis can be prevented. That is the one. So from the government also we can urge. So in other parts of the country, like in the America, they have made specific guidelines. There is exercise guidelines for the arthritic patients. So what are the exact exercises to be done? Where they are recommending that 150 minutes per week moderate exercises. That's a low impact exercises that are beneficial for the arthritis. The similar type of booklet we can make, and we can hand over the booklet to them in their native language, or we can make a app like that. So in app, are you suffering from this that, like that? There are simple questions. If they fill up this, we can easily pick up from them, because everybody has some smartphone. So with their smartphone, if we use this app, so they can fill up the app, and they can send like a Google form. It is very easy now. We can pick up the arthritis patients, and we can advise those arthritis patients what to be done in the long run. So we can so I think these are the way we can. Another there are some NGO also. There are several NGOs, they're working in different parts of the country. We can urge also for the NGOs also. They can go connect to those areas, those who are not properly connected, where the healthcare facilities are not adequate. So in those areas, they can make a either the e-meeting or the physical meeting to take out the exact patients who are suspecting arthritis.
Right. Thank you, Dr. Ananda, for that. Very quickly, moving over to Dr. Arnab. We have already put up this question with the rest of the panelists, so I'd like to ask the same from you as well. In your experience, what are the common misconceptions about arthritis, and how do you feel we should address and rectify these misconceptions through such campaigns that we are doing? So, over to you, please.
Yes, yes. I think Sir has beautifully explained everything. One point I want to add is that the awareness is also required in among the doctors, like other general doctors, because in remote areas, the first contacts of these people are the general physicians, GPs. So they should also be aware to picking up arthritis, how to pick it out, when to refer that to a specialist, and how to give at least some care at the point of emergency or some relief at the point of emergency. And another important to not to misuse of some drugs like antipsychotics. So few basic communication is required among us, among the doctors and among the GPs also. And I think what are the most difficulties I have seen among the patients is that first of all, they are not able to accept that they are suffering from arthritis. Always think that this is sort of some sprain or strain or something, or maybe this pain is because of some hyperacidity that is happening, so it will go away with some medications. So they are very reluctant, even if you explain to them and say them they come with all these reports and all. So they will not come by that time. They will delay it on because there are a lot of misconceptions growing in the community. And even if you go to rural areas, there are a lot of other therapies are also available for treating all them. So they will go to the alternate therapies. They will have some other things done and they will come back when it's too late. So awareness, increasing awareness to the patients is very important. Second is, I think the easy availability of the healthcare system should also another point, which is not there in all setup. Like some of these blood investigations like anti-CCP, HLB27 and ANA profile of arthritis, specific arthritis detection are actually costly for a common people. So maybe if we can look, maybe the labs can come up so that they can decrease the cost of the detection, so that these tests and these things can be implemented or streamlined into the screening pattern. Suppose in every 5 years, a patient who is somehow suffered from joint pain should be screened for some type of arthritis. So if these things can be done at the interior level, at the rural level, at the basic health structure level, then I think a lot of people can make be aware of these things, along with the point suggested by Professor Pal that education, and increasing the awareness among our patient is the keystone of successful arthritis treatment, because not only detection or prescribing medicine for them, also important is adherence to the treatment. So they need to understand that arthritis, you need to continue the management and you need to continue the follow-up for successful outcome with the doctor.
Right. Thank you, Dr. Arnab, for that nicely elaborated answer. Now, to my panelists, as we move towards the last part of this discussion, where I'll start with Dr. Vineesh. My question for you will be some preventive measures that you would want to tell and educate our audience about for people maybe reducing their risk of arthritis, or for people who can slow their progress of arthritis. Some preventive measures, including everything that you'd like to say, please.
Uh, First thing is that uh, there should be knowledge of the disease they are having. Uh, Self advocacy is important. Whenever you have a problem, you have to come forward and ask your clinicians, educate yourself. The lifestyle modifications are important, because if you are obese and that is damaging your joints, that is creating some the disease progression is increasing. The speed is up. If your weight is decreased, that may help in delaying the progression of the disease. If your food habits are correct, if your bones are at the end of the day strong, they will not deteriorate. So it is important that you keep your bones strong in form of correct diet and correct intake, exposure to the sunlight. Uh, do what is actually not damaging your joints. If you are having osteoarthritis and you are squatting or jumping, that may deteriorate the disease. The disease has to go in different stages, 1, 2, 3, 4. So it will keep increasing. So what we have to do once we are diagnosed with the disease, that and what type of arthritis we have, and if it is osteoarthritis, we have to avoid everything which increases the severity of the disease. If in course of if we assume that the disease is going to progress in 5 years, our prevention, our modification, our food habit should increase the duration, expand the duration to 20 years, so that we don't come to a stage when we need total knee replacement. But that is important for the patients to understand that they have role. If they cannot at least go back in the severity of the disease, they have the role of not making it more severe due to their negligence.
Right. Thank you, Dr. Vineesh. Very similar question to Dr. Ananda, please. Over to you. You need to unmute yourself, sir. Really sorry.
I want to make our patient's life easier. There's the A rule of ABCDE. A for that is the activity. We have to become active. How to prevent arthritis? We have to become active. There is one A for activity. B for be alert. Be alert means what? You will be alert for your awareness. That is why we are here, to increase the awareness. C for the connectivity. We have to connect by different peoples. The same type of peoples that you have to talk. Sir, you are feeling arthritis, you are feeling pain. What you have done? So connect with the fellow people, connect with the doctors, connect with the other persons in the society, so that they require support. This is most important. For the initial period, we have to take the support. D for the don't hide. Don't hide any problem of your joint. So this is a very, very sensitive part. So don't hide is D for the don't hide. And E for exercise, exercise and exercise. This is most important. Again, I'm repeating. A for the activity, B for the be alert, C for the connectivity. You have to connect with others. Don't think you are alone. And D for the don't hide your any problem which may be related with your arthritis. And E for the exercise. A, B, C, D, E. This is the most important factor to prevent arthritis.
Very, very, very nicely summed up, Dr. Ananda. So as we move towards one last key message that each one of my panelists here would like to tell to all the audience here, be it fellow colleagues of yours, be it patients, be it caregivers, a message, a take-home message. We'll start with Dr. Arnab, please.
Yes, yes. So, as in the rhythm of the program, I think our aim is to prevent arthritis, treat it in a proper way, so that we can prevent deformities, we can prevent immobile lives, and if at all you require to do something, so that is our message. That if at all your joint is destroyed, it is deformed, please don't neglect yourself. Get a joint replacement done, a nicely timed joint replacement which is done in a proper time can give you almost normal life back. So that there is stigma regarding arthritis, there is stigma regarding joint replacement surgeries. Those are actually myths, that those are not correct. So please don't neglect your disease, get it treated properly from the proper person, and get a normal healthy mobile life.
Thank you, Dr. Arnab, for those nice words. We'll move over to Dr. Vineesh. Your key take-home message for everyone who has engaged with us for this session, please.
The people should understand that our medical science has improved. We have armamentariums in our treatment that we can help you get back to life. You have to believe that whatever the doctor is suggesting, whether be it lifestyle changes, exercises, food, medications, all the new medications are available, which are now they're very powerful, and they get back to you in the best possible way in the life. So you should not fear your disease. The surgeries which are recommended in the earlier stages, when there is a deformity and yet the joints are not still damaged, we can have corrective joint alignment correcting surgeries which can help decrease the severity of pain and decrease the duration of getting the knee replacement done. And even if it is knee replacement, that is not a bad option. It has not to be done very early. It has to be done only when the symptoms are more than 50% of your tolerance, so that you find the benefit of that disease. and their results are 100%. You can get back to life back, and we promise you, you will not be pain. Will not have pain. Thank you.
Thank you, Dr. Vineesh, for that answer. Dr. Ananda, your take-home message and an advice for everyone watching this particular episode, please. Sir, you're on mute.
Yes, yes. My take home message already I have been told that is A, B, C, D, E that have to be followed by everybody. And I want to remind that there is the proverb, it's a problem. So don't think it as a problem. Arthritis, that is a part of the life. So problem comes not to destroy you, to make you stronger than before. So don't take it as a problem. Take it easy. That is a game. You have to win. I think
Right.
this is the message.
Thank you, Dr. Ananda. So, with this, I'd like to bring this particular panel to a closure. I'd like to first of all thank Pfizer for powering this series of discussion. I'd like to thank all the viewers who have engaged, and lastly, and most importantly, I'd like to thank my panelists, Dr. Ananda, Dr. Arnab, Dr. Vineesh, and Dr. Saurabh, who took time out of your schedules and spent time with us creating this awareness. We thank you and really appreciate the time and the educational awareness that you guys spent. Thank you. Have a good evening.
Okay. Bye.
Thank you. Thank you. Good evening.
Thank you. Bye.